This is Dr. Robert Antelak from theGeneralDentist.com. We're located in Shelby Township, Michigan. That's Macomb County, right here in Michigan. And our office phone number is 586-247-3500. What I'd like to discuss is what happens if you have a traumatic blow to a tooth, a child or even an adult, and what to do about it. So if this has happened to you and you're watching this for the first time, please just give your dentist a call right now. But the first thing you can do is, if you have that tooth available to you, just try to gently rinse it off gently in water and maybe in some milk, and then try to, if you can, try to place it right back into the socket of where that injury took place. Teeth are, if you look at maybe an adjacent tooth to where that one came out and match up what it looks like, just match what it looks like and just push it gently up into the socket. That's the best thing you can do if there's an injury. You want to get into your dentist within less than 45 minutes to prevent really further damage that will not be reversible. So if you get hit, most injuries that take place are basically where the tooth fractures. When it hits, the tooth stays into the bone, but all that impact takes place on the crown part of the tooth. And if it fractures like that, what you want to do is you want to try to look for that piece that broke off. If it's at all possible to find that piece, it's really important. The reason why it's important is when you go to your dentist, we can approximate exactly where that fractured part of that tooth, if it broke off in one piece. And we have binding agents that are so thin that we can literally take the segment of piece that's there and bond it directly onto the fractured portion of that tooth, and that will many times look really good, very natural, and sometimes can have a long-term successful result. So that's if a decent part of the tooth is broken off. If the nerve is exposed at that point, what would happen is when you go to the dentist, more than likely you have to remove that nerve out of that tooth, so that because that nerve will go bad, and then fix it that way. Either use that fragment of that tooth that broke off, or have to rebuild it with tooth-colored bonding material. So that's when injury takes place just on the crown part of the tooth. Next, if an injury takes place and that tooth is loose, but it's still in the socket, if you can, if at all possible, before it starts to heal too much, or over time, you want to just try to push that tooth up into that correct location, okay? Don't overcorrect it, but try to put it right into that same spot. What will happen is because there's hemorrhaging going on, there's bleeding, and when there's trauma, inflammation will start developing. So what you want to do is, if you can place it up there, you'll displace some of that blood, and if you can do that, you'll get that into the right place. Many times, those fibers that hold the tooth structure in place, for example, if this were like this has come loose, and it doesn't fall out, but it's just loose. If you can just take it and just push it straight up into there and just hold it like that, and that would be very helpful to do that. Because the root is not exposed really to the atmosphere, it still remains sterile at that point, so just push it back in and get to the dentist, and probably do something to help bond that to the adjacent teeth. Now that's if the tooth is loose. If the tooth does come out completely, like this, that's what you want to do when a tooth comes out completely, is you want to, once again, find out where it goes in the mouth. You can see usually where it is, and the front teeth look more like chisels than anything, and there's a root that sits right there, and that root structure right there, it'll go right into that area and just push it straight back in. If you cannot do that if possible, you want to store that in milk, or have the child, if it's not too young of a child, just put it in the cheek of the, like the lip part of the mouth, and just hold it in there until you get into the dentist. Get to the dentist as soon as you possibly can. And so the reason why it's important to do that is you want those, there's a fiber, there's like elastic fibers that attach the tooth structure itself to the bone. So right along that root surface of that tooth, if these dry out, you're going to lose that tooth for sure. But if they stay moist, usually in milk or using even their own natural saliva, then once it goes in place, it'll stay there. There's also a solution that you can find out if it's an athletic event. You can talk to your coach and see if they have a certain solution, a ringer solution, that can store that tooth right in there, and it remains at a good thing where you can get to the dentist, and it can many times be successful to retransplant that tooth. Once in the office, it can be usually bonded to the adjacent teeth for a certain period of time, not too long, and then sometimes have to do root canals to remove the nerve out of that tooth. So there's a number of different things to do. Number one important thing is try to get to the dentist as soon as you can. So if there's any questions, please give us a call, 586-247-3500, and we'll see what we can do to help you out. Thank you, and you have a great day. God bless.